Sleep-related breathing disorders are extremely common. So they lie on a spectrum. At this end of the spectrum, we have simple snoring. At this end of the spectrum, we have severe obstructive sleep apnea. And the patient could be anywhere along that spectrum. Not only does it affect the patient's quality of life, but it can affect the partner's quality of life because sleep is very important. Patients who snore will disturb their partner's sleep and it could affect their daytime performance. Patients who snore have an upper airway obstruction because of turbulent airflow from the nose to the larynx. If there's obstruction sufficient enough to cause breath-holding episodes, patients would often complain that they find the sleep to be unrefreshing. They would complain that they have daytime sleepiness. They would complain that they have morning headaches. The partners complain that they have witnessed apneic episodes. Now, if they have got sleep apnea and they leave this untreated, this could have quite significant detrimental effects to their heart and their brain. These patients are at a high risk if untreated for developing high blood pressure, arrhythmias, heart attacks, angina, type 2 diabetes, strokes, cognitive dysfunction like poor memory, concentration, and even dementia. As well as that, they can have a higher chance of having road traffic accidents because they can't concentrate and focus so much. There's so much available to treat patients with snoring and sleep apnea. Simple lifestyle changes like weight loss, cutting down on alcohol, cutting down on smoking, not sleeping on their back can help. Appliances can help, such as mandibular advancement device or CPAP therapy, which can be used for moderate or severe sleep apnea. Surgical treatment is also available for patients, especially if they have an isolated problem in the nasal cavity, secondary to nasal polyps or a deviated septum or allergic rhinitis, or if they have large tonsils. In particular, in children with snoring and sleep-related breathing disorders, it is quite common to notice that they've got very large tonsils and large adenoids. And doing adenotonsillectomy in children for this reason is very productive and very effective. For the adults, we now do assessment with sleep studies and drug-induced sleep endoscopy to try and tailor individual management plan for every patient. And this would include either non-surgical treatment as mentioned, or surgical treatment, or indeed a combination of both. It is important to have a good night's sleep both for the patient and the partner.